Hey, it's Jeff Nelson. Today I am excited to welcome back for another fascinating presentation, the one-of-a-kind Dr. Peter Rogers. Welcome, Dr. Rogers.
Hey.
Yeah, always great to have you. Dr. Rogers is a regular guest on my channel, coming in at least once a month to generously share his insights and advice on a wide range of health-related topics. And for those of you who might be new, Dr. Rogers is more than just a practicing physician. He's a true scholar and thought leader. He was at the very top of his class at Stanford, at Northwestern, at Harvard. And today he continues to push boundaries, not only in medicine, but in public education as well. When he's not treating patients, Dr. Rogers is busy running his popular YouTube channel where he publishes in-depth videos on health, science, and the latest research. And I'm putting a link to his channel in the description here. And he's also a prolific author, producing high-quality, information-packed books that deliver a lot of value. And I'm going to put a link to his author page on Amazon so you can check out his books. Dr. Rogers has been a doctor for 30 years, and he's an expert on weight loss, atherosclerosis, writing, public speaking, and academics in general. He has a proven method, or I should say methods, for preventing diabetes, stroke, coronary artery disease, hypertension, all that stuff. And today he's diving into a topic that's critical for all of us as we age, and that's dementia. Dr. Rogers has developed compelling theories on what causes dementia and, more importantly, how we can prevent it. You definitely want to stick around for this talk. He challenges some mainstream views and shares very useful strategies to protect our brains as we grow older. So, without further ado, let's get started. Dr. Rogers, welcome back. Should we just get right into it?
Sure, thanks.
All right.
Okay, let me go into my talk here. This talk comes from this book right here that I wrote called Food, Mood, and IQ, which basically rewrites a lot of psychology textbooks, psychiatry textbooks, and neurology textbooks. And what we're going to go through now is clarification of what causes dementia. Okay, so we're on chapter 5 here, dementia theories. And the first question with this illustration is conventional medicine like a witch doctor clown show? When I was a kid, there were cartoons on TV making fun of stupid people who went to a witch doctor to get a magic potion. But isn't that what Americans do nowadays when they go to internal medicine or most other doctors, especially all the internal medicine-based subspecialties? And the internists will say that witch doctors and quacks use treatments that are based on superstition and tradition, that they're not, that American medicine is different, it's based on science. And I'm like, yeah, right. Internal medicine, how different is it than superstition? It's not based on the science of healing, it's based on the science of money making, how to get a patient hooked on a drug. The basic concept is if you cure the patient, you lose the customer. So conventional medicine does not want to cure the patient. The average patient goes to the doctor thinking they're there to help me. And I think the doctors, they all go to med school wanting to help the patients, but they get forced into this assembly line mentality where they got to generate more and more billing codes every day. And the fact of the matter is they're not paid for teaching and empowering the patient, okay? So here's the big secret number one you have to understand if you want to have good long-term outcomes. Conventional medicine never cures chronic disease. That's why they call it chronic. It means they cannot cure it. But in comparison, nutrition with a low-fat vegan diet and avoidance of toxins, it routinely cures most of the so-called chronic diseases. What's the cure rate for pills, stents, and surgery for, elective coronary artery disease, cardiac angina? It's about 0%. The patient takes pills for life, and recurrent events like angina and heart attacks are common. You don't live longer after you get a cabbage or a stent for, chronic cardiac angina, chest pain related to coronary artery disease. What's the cure rate for low-fat vegan diet? It's essentially about 100%. Dr. Esselstyn says every single patient who actually followed his diet, none of them had any recurrent events. The one that he reported in that July 2014 study in the Journal of Family Practice, that patient wasn't following the diet, okay? So the cure rates are super high for obesity, hypertension, diabetes, okay? We just talked about reversal of atherosclerosis and for a lot of other stuff. It's like, why wouldn't you want to know about this? Okay, for anybody who knows the truth, it's obvious that learning about nutrition and toxicology is a smart thing to do, okay? Okay, now here's a bit of a normal distribution of dietary choices. So the vast majority of people eat some version of the SAD diet, paleo, keto, carnivore, low-carb nonsense. And they're, fat, sick, and stupid typically by about 55 years of age. Okay, I got my internal medicine friends and my personal experience joins it. The vast majority of patients over 60 are cognitively slow, fat with multiple medical problems. Sort of the gateway diseases are obesity, hypertension, prediabetes, diabetes, and then atherosclerosis, which manifests as coronary artery disease and impotence and whatnot. Okay, and then the doctors tend to be a little bit better off. Not much, but a little bit. They tend to be lacto, ovo, pesco vegetarians that still ingest things like olive oil, and often they take high-fat supplements like omega-3s or nuts, a lot of fat. So they're sort of half-screwed. They live a little bit longer. There's really only about 1% of people, if that many, that have a reasonable understanding of nutrition. It might be closer to 1 in 1,000, okay? And it's easy to learn nutrition. It's pretty simple. Just eat low-fat plant foods. The hard part is unlearning what you've sort of been raised on as a child. Oh, I need meat to be big and strong, for example. Okay, and everybody's worried, we talked about this before, getting enough calcium, protein, and good fats, and those are all non-issues. It's impossible to be too low on those things with any normally chosen diet. The most common nutritional deficiencies amongst Americans are just, lack of fiber, potassium, magnesium, and nitrates, nitric oxide precursors, and antioxidants. And the reason is obvious, because they all come from plants. Americans don't eat enough plants. So let's see, and then they also ingest lots of toxins in all these processed food. These non-organic foods often have a lot of stuff in them. Plus, it's a good idea to avoid alcohol, all caffeine, sweets, all this stuff. Okay, I got to get used to this thing here. Scrolling down. Okay, so here's the next picture. This is just showing you that the brain is more dynamic than people think. It used to be they thought the brain was like a TV set. Once you buy it, it's all hardwired. There's nothing you can change. But in reality, we're constantly learning new things, and we can change our brain a lot. The more you exercise and the more you read, think, and have intelligent conversations, the more angiogenesis, the formation of new capillaries to supply active areas of the brain. The more you produce BDNF, brain-derived neurotrophic growth factor, to produce new synapses, connections between the neurons. Here's a synapse. Here's a presynaptic, postsynaptic neuron. Neurotransmitter diffuses across this cleft to exert an effect on the postsynaptic neuron. You produce more glycogen. Energy gets stored. Just as your body develops increased glycogen stores with exercise, your brain does too with cognitive use and with exercise. The brain is largely for movement, sort of like the old Voltaire question, why do animals have brains but plants do not? Because animals move, okay? So they go hand in hand using your brain, your vision, your sight. You turn your brain on when you start walking and moving. The old story is like the sea squirt in its juvenile phase, as a tadpole, it swims around as a brain. In an adult phase, it attaches to a rock, becomes a filter feeder, and its brain is reabsorbed, recycled. You don't need a brain to be a filter feeder sitting on the couch watching TV with the remote. So anyways, everybody of any age is always forming new synapses to form new memories and whatnot. Plus, there's a use it or lose it component. The more you use the neuron, the more it will be myelinated, which is sort of like a fat coating on the outer surface of the neuron to insulate it, if you will. It leads to a type of neuronal conduction called saltatory conduction, whereby the impulse jumps between the little myelin covering. So the bottom line is the more you use that pathway, the faster it will get. Okay, and there's also like security guards of the brain and the microglia, and you don't want those activated for no reason. They get activated unnecessarily if a person has leaky gut, is not eating enough fiber. So fiber protects not just your gut, it protects your brain. Okay, we went through this. That's important to remember, use it or lose it. So also, you want to keep moving. I would strongly recommend whatever you do, try to get more movement into your day. That's one of the best predictors of aging well. Okay, and if you don't keep doing stuff like push-ups or whatever else it is, you'll get weaker and weaker and eventually lose that ability altogether. Okay, the next concept here is penumbra. Penumbra means twilight. And the people will first hear about this word in the context of a stroke. So this black circle right here is dead brain, called the infarct core. Infarct just means dead brain due to lack of blood flow. And then the surrounding brain that's gray, the twilight zone, is brain that could go either way. If blood flow is restored, these neurons could come back to life. But if blood flow is not restored for a prolonged amount of time, these neurons will just die. So I think a lot of people have variable amounts of penumbra in their brain. And to protect that penumbra, you want to maintain good blood flow to your brain, good oxygen and glucose delivery. Okay, why should you read this book? Because I'm going to empower you. One of the reasons why I say I'm empowering you is because what people are typically told is that Alzheimer's is the most common cause of dementia, and that, nobody exactly knows what causes it, but, you might as well try their pill for treatment and hope for the best. But if you actually read about the history of Alzheimer's, I'll get into it a little more later. You'll see that it's really a bogus disease and a bogus diagnosis. I'll explain that in a moment. So let's talk about what really happens in dementia. The first theory I think everybody should learn about is the Jack Delatory theory of chronic cerebral hypoperfusion. I call this the mouse equivalent theory. It's also been called the vascular hypothesis of dementia. This is big stuff. You have to know the Delatory theory of dementia just to be able to make sense out of things. Later on, we'll get into my theory, the Peter Rogers, MD theory of supply and demand. Originally, I first called it neurovascular uncoupling, but supply and demand is easier to understand. And we'll get into that later, but we're going to have to, you need more knowledge and understanding of pathophysiology before that'll make sense for you. Okay, I'm going to tell you about the Tetsumori Yamashima theory. He's a Japanese neuroscientist who was given the task of figuring out why are so many more Japanese people becoming demented compared with the past. And he figured it out was because they're eating these omega-6 cooking oils. That leads to the production of, first of all, lipid peroxidation, production of toxic aldehydes like hydroxynonenal, H&E. And so I'll explain that in just a little bit. So bottom line, though, you don't want to eat omega-6 cooking oils, okay? In Delatory's theory, you got to be careful. You don't want to be hypertensive, and you don't want to overtreat hypertension either. So mild hypertension is not that big of a deal, but bad hypertension, high hypertension, as well as overtreatment of hypertension is a big deal. Next is the Douglas Kell and Etheresia praetorius theories. And this largely is related to postprandial endotoxemia, where you get the bacterial, across the leaky gut, you get bacterial endotoxins going into the blood, and they not only make your blood more prothrombotic, predisposed to clotting, they also cause activation of microglia in the brain, so they cause neuroinflammation. Not good. The next theory, good to know about, is the Jared Younger and Russell Blaylock theory of neuroinflammation related to microglial activation. So Kell and Pretorius were really up on amyloid clotting as a mechanism of prothrombotic effects from postprandial bacterial endotoxins through leaky gut. Okay, Blaylock and Younger are more big experts on microglia activation, and that'll lead to the destruction of neurons. Okay, Blaylock actually coined the term for this theory as immunoexcitotoxicity, meaning that it is related to excitotoxicity. All of these things are related. Okay. Let's see. And he was friends with John Olney, who figured out MSG was a brain toxin back in the 1960s. Okay, we're going to get to all that stuff when I go over the theory in more detail. Next theory to be aware of this is just a quick overview of the theories. It's good to be aware of Martin Pall and his no-oh-no theory, okay, especially as it relates to EMF, electromotive force. No-oh-no means nitric oxide, peroxynitrate. I know you think nitric oxide is a good thing, and it is in the context of like what Dr. Esselstyn spoke about in your arteries of your body. But there's a separate type of nitric oxide in the brain from microglia, not from endothelial cells that can damage brain cells. Okay, I'm also going to show how the Martin Pall theory of cellular destruction and vicious cycles has been overcome in the work of cardiologists Robert Ostfeld and Baxter Montgomery. They wrote some fascinating case reports where they have successfully reversed congestive heart failure. That's a big deal. So Doctors Ostfeld and Montgomery have reversed congestive heart failure. Okay. The next thing is the toxin theory of dementia. And, Dr. McDougall spoke a lot about this. Jeff Nelson had a very nice video about the effects of heavy metals as they are related to contributing to the causation of dementia. This guy also, his nickname is Mr. Aluminum. This guy, he writes a lot about that as well. So aluminum is a major neurotoxin. And a lot of people aren't aware, but your typical municipal drinking water contains aluminum. It's a clearing agent, if you will. Things will bind to it and the water might look more clear, but it's a major neurotoxin. You don't want that in your water. So at the very least, you want to have something like a whole house carbon filter, but in your kitchen, or reverse osmosis filter to get that stuff out. Let's see. But it's best to start by talking about Jack Delatory. So Jack Delatory, he tied off the internal carotid artery in mice, in the mouse, right in the neck, he tied it off. That's the main blood supply to the brain. And then the mouse, 2 months later, became demented. And when they did an autopsy, he first expected to see a big stroke right on the side where he tied off the artery. But he went and looked at the mouse brain. It wasn't stroked. It was just shrunken. That's called atrophy. It was atrophic. And he realized whatever pattern of arteries he tied off, they would eventually get atrophy in the supplied region. Okay, so the brain cells are dying slowly, like an apoptotic death. That means programmed cell death, where the cell dies gradually and recycles itself. Sends its proteins and nucleic acids to be recycled. Okay. He experimented with tying off bilateral carotids, bilateral vertebral arteries, even the intracranial MCA, and he always got the same thing. Chronic mild to moderate deprivation of blood led to the slowly progressive death of neurons. Okay, that's going to be highly relevant. Okay, so as far as a neuron is concerned, glucose and oxygen delivery are GOD. So I use it in lowercase, and it's a bit of a joke here. What that means is glucose and oxygen delivery. As far as the brain cell is concerned, that's GOD. Okay, all right, so you say, well, who cares about that? Not that many people have carotid artery occlusions. And it's true. I don't often see an internal carotid artery occlusion because I look at lots of CT angiograms of the brain, but I do see them occasionally. And I do see, moderate stenoses pretty often. I'll see one a day, and I'll see a bunch of normal carotids. But anyways, this guy, Dactyl Torrey, he's really smart. He's a really good scientist. He goes, it's not just about congestive heart failure. It's not just about carotid artery stenosis. What about congestive heart failure, CHF? Tons of people have CHF. That's when the heart doesn't pump with enough power of the blood. It'll have a decreased ejection fraction. Instead of being 55% and up, it'll be like, 45% and down, okay? So you're not getting as much blood pumped to the brain. The reason why you have a blood pressure is to pump blood to the top of your brain, your cerebral cortex at the top of your brain. You don't get enough blood up there, those brain cells start to die. So lots of people got CHF. How about atrial fibrillation? Lots of people got atrial fibrillation. That's abnormal contraction of the heart. And then you lose the atrial filling, which is up to 25% of ventricular filling. So you're going to have decreased blood going up to your brain. Not good. Okay. Let's see. Tori's just warming up. He says, what about overtreated hypertension? So if you got a patient with a baseline blood pressure, let's say their pressure is 170 over 100, okay? If you put them on a bunch of hypertensive medications and it drops to, let's say, 110 over 70, that might sound nice, and that might be just perfectly fine for a regular person, but that's not good for your previously severely hypertensive patient. You drop their pressure too low, you might not. Why was their pressure high in the first place? To get blood to the top of their brain. You haven't fixed the problem. You haven't addressed why was the blood so thick. That's the most likely problem. So what I'm saying is when you overtreat that hypertension, you can drop blood supply to the top of the brain cells die. And then the other catch is, it's like you're looking for a Goldilocks balance. If you just leave the pressure real high, the high pressures will damage the bifurcation points in those arteries, and that will cause atherosclerosis. That will cause hypertrophy. Collagen will be deposited in those segments to thicken those arterial walls, almost like to restrain them from the pressure, to reinforce them from the pressure. But now, because they're thicker, less oxygen can get to the tissues. So you're screwed either way with hypertension. Mild hypertension is not that big of a deal, but overtreated hypertension, big deal. And severe hypertension, big deal. Okay, if you undertreat hypertension, it damages the artery, like I was saying. So you're sort of in a damn if you do, damn if you don't. You're looking for the Aristotelian golden mean. You get just the right amount. And what I'm saying is, instead of jumping first to a pill, why not just fix your blood, which means make your blood thinner. How do you make your blood thinner? You just stop eating so much fat. The other thing is you make sure you're eating enough fiber so you don't have postprandial endotoxemia with the leaky gut and the bacterial endotoxins getting in your blood and causing it to clot. Excessive dietary stress, caffeine, sleep deprivation, they also make your blood get a little thicker. They predispose to clotting. Dietary sodium can increase platelet activation, making it a little more prone to clotting. So you get a whole bunch of things adding up to cause more clotting. Atherosclerosis, by the way, is a blood clot, okay? That's important to know. Remember that the rest of your life. Atherosclerosis is a blood clot, because once you understand that, then you can make sense out of atherosclerosis. The medical school textbooks, they're all Mickey Mouse Jr. They just tell you cholesterol is a risk factor for atherosclerosis, but you need to know it's a blood clot. Believe me, I'm friends with Gregory Sloop, the best atherosclerosis pathologist in the world. He looks at it under a microscope and he goes, it's a blood clot. Okay, and I look at CT angiograms, MRA angiograms all the time, catheter angiograms, and I can tell you the best one is CT angiogram. It's a blood clot. We can't tell the difference because they're the same thing. Okay, Torrey continues, Jack Della Torre says, and diabetes also damages the arterial wall. It thickens the capillary basement membrane, so less glucose and oxygen can be delivered. You can call it a diabetic microvasculopathy. Some people call it endotheliitis. But the bottom line is less oxygen and glucose delivered to the cells. And Della Torre has got more counts. What about aortic regurgitation, aortic valve disease, regurg or stenosis? Chronic cerebral hypoperfusion, you're like a mouse. I call these things mouse equivalents, okay? What about when a patient has coronary artery bypass graft surgery? When they actually do the operation, they slice open the sternum with a round saw, and then they put the patient on cardiopulmonary bypass. And the worst part, I think, is post-operative. For example, my father had a CABG. That was, I don't know how many years ago, 27 years ago, something like that. And I was in the hospital with them in the ICU. You should always stay with your family member if they're ever in an ICU or a hospital bed and they're not 100% super fully with it. Because things happen in the hospital. So anyways, they're running my dad's blood pressure super low, 90/60. And I called to speak with the anesthesiologist. Said, why are you doing this? And he goes, well, we don't want him to bleed it as anastomosis. That's where they plug in the grafts. And I'm like, my dad was a lot healthier, I think, than the average CABG patient, and he tolerated it just fine. But it's quite understandable to me why a lot of CABG patients get pump head, meaning after having open heart surgery, they have a drop in their cognitive function because they're not perfusing their brain while anesthesia is running their pressure so low. And then Jack Del Torre had one last thing. He said, why did Ronald Reagan become demented? He says he thinks he knows. Ronald Reagan, in his time, he was a brilliant politician. His state was rich. Okay, I went to Stanford in the 1980s, and I can tell you the place was rich. There were people going to these community junior colleges for free. Okay, it was rich. Now it's like poverty, third world. Okay, so anyways, Del Torre says that after Reagan, had a severe blood loss, his hypotension, he was hypotensive for a prolonged amount of time. He had a low blood pressure, and he thinks that damaged his brain, and then the dementia just manifested gradually over the years after that. Okay, so, Del Torre deserves a Nobel Prize. He did fantastic work. I can tell you most of the great research, they never get anything. The reason is, the big corporations don't want the public to know about this stuff. You'll never see Caldwell Esselstyn get a Nobel Prize. I'll bet you Dean Ornish never gets one. He might. They'll give it to him for something that they don't care the public knows about, maybe his telomeres or something. They're not going to give it to him for atherosclerosis. They're not going to give it, to Dennis Burkett for figuring out abdominal pressure syndrome. They don't want the public to know about these things. Okay, they're usually just given to people who promote a drug in some way. Okay, so like I said, these are the mouse equivalents, ways that you get cerebral hypoperfusion analogous to tying off the carotid artery like what Jack Del Torre did. Here, by the way, is Jack Del Torre's book. It's a great book. It's a great book. The Alzheimer's Turning Point. Okay. And like I said, you want to learn that first. It sort of builds up your brain to understand everything else that comes next. Okay, now we're going to talk a little bit about Alzheimer's. And here's what I'm going to tell you, that Alzheimer's is a joke, okay? Lots of conventional medicine stuff is a joke. All right, so why was I say Alzheimer's is a joke? What's the historical question you can ask the patient and confirm the diagnosis? There is none. What's the physical exam finding? Put a stethoscope on them, can you tell they got Alzheimer's? Nope, there is none. Can you do a blood test? There's none that are reliable. How about a brain MRI? They're going to tell you the characteristic appearance of parietal temporal atrophy, medial temporal atrophy. I look at them all the time. I hardly ever see that. That's nonsense, okay? I usually see diffuse atrophy. All right, well, what about nuclear medicine imaging like an amyloid scan? It can hint at it, the idea of amyloid accumulation, but it's really not that effective to diagnose. So you can see it in people who don't have it and vice versa. How about autopsy? That must be pathognomonic. You take them to autopsy, but the problem is you can see people who are clinically presumed to have Alzheimer's, but they don't have much beta amyloid protein, senile plaques, SP senile plaques, or neurofibrillary tangles, NFTs. And a cognitively intact patient might have a bunch of the same things, senile plaques and neurofibrillary tangles. These are typically extracellular. These are typically intracellular. The point I'm making is look at the Notre Dame nun study in Mankato, Minnesota. They took all these nuns who donated their brains to science, and they find out the ones that were more sort of educated, academic, enjoyed writing letters and teaching, those nuns were less likely to become demented, even if they had lots of senile plaques and neurofibrillary tangles. And this became the cognitive reserve theory, meaning that you're able to lose more brain tissue and still function if you have a higher baseline amount of cognitive function. And that was sort of like trying to save the amyloid theory of this stuff, senile plaques and neurofibrillary tangles. But it's quite overrated, like I said. And then what's their treatment? They'll give you a pill that doesn't work and causes a bunch of side effects. So what type of disease? You can't diagnose it when the patient's alive. You can't diagnose it when they're dead, and there's no treatment for it. That's BS, okay? That's nonsense, all right? It's just stupid. And why does Alzheimer's get so much hype and called the most common thing? Because the research foundations that wanted to get grant money, they had to say it was the most common thing, because the more common they can claim it is, the more research money they get. Believe me, there's entire books about how bogus the research was and what a big joke it is. You would be amazed at what a joke it is. Okay. We're going to later on, like I said, get to my theory of supply and demand or neurovascular uncoupling, but we got to go through a bunch of introductory topics first and get you solid on hypertension, diabetes, atherosclerosis, heavy metals, etc. Then we'll get to that. Let's see. Also, the way to get the most out of this book is, look at the pictures, then read it, and then also watch the internet videos by me on YouTube, as well as by other persons who've given talks on all these subjects. Here's a book that's a good one, and it was sort of a landmark when it came out in 1997, Excitotoxins by Blaylock. And he did a real good job in going through the history of like monosodium glutamate. Glutamate's 90% of your cerebral cortex neurotransmitters. It's an excitatory neurotransmitter. So you think of glutamate as the light switch. It turns the light on. And that's 90% of neurotransmitters. And then GABA turns the light off. That's about 5% of neurotransmitters. And all the famous neurotransmitters that everybody knows about, they're only about 1% each. That's things like acetylcholine, dopamine, norepinephrine, that sort of thing. But remember glutamate. Glutamate's the real important one because that's 90% and it's excitatory. It turns the postsynaptic neuron on, increases metabolic activity. So John Olney, working with rodents, he saw that you inject that into a mouse brain and it has a seizure. It's super potent to activate the mouse brain. And then they found out, the Japanese with the umami receptors, they found out that you put MSG in food, monosodium glutamate, and it tastes great. It's sort of like a neurotransmitter. It's the amino acid glutamate is a neurotransmitter, excitatory neurotransmitter, as we spoke about. And we have reward neurotransmitters in our brain that are activated when you ingest MSG. It makes food taste good. It can make stale old food taste good. So they put tons of it into processed food. And we have taste receptors for MSG in our mouths and elsewhere. And they're really for glutamate, not so much for MSG. MSG is just a convenient way to deliver it. Nowadays, most of it's delivered in the form of MFG, manufactured free glutamate. Okay, because our ancestors, they worried about starvation every day. Finding a good protein source was useful to them. But in the modern world, people aren't underfed, they're overfed. Okay, and it's felt that small chronic daily doses of MSG leads to gradually progressive brain damage. And Blaylock felt that more moderate dosages can lead to rapid onset Parkinson's, and a single very high dose can lead to ALS, amyotrophic lateral sclerosis. Those are relatively uncommon, especially ALS. So we're not going to talk about those anymore right now, but I'm just sort of getting you going here to learn about excitotoxicity. Trust me, it's a big deal. It's like one of the most important things you can know about the brain. And here's the joke too. I own the big, Ivy League neurology textbooks, 1,500 pages, 2,000 pages. They'll have 1 or 2 paragraphs on excitotoxicity. They're a joke. They're all stupid. And by the way, I teach neurologists. Neurologists come to me to teach them about neuropathophysiology. Okay, and I know the smart ones, fellowship trained neurologists, and that's what I think is funny because their own books don't teach them. I always find that amusing. Okay, so what's the key point? There's lots of things you can do to help yourself. Okay, when I kind of joke in the mystery method about how to date women, there's something called AFC for average frustrated chump, and I call the average typical person in my experience the ADS. Average dumb S, okay, because they do so much stupid stuff and they make themselves sick and it's so hard to talk to them. We'll call the wise patient a WP. All right, so anyways, and also my format of lecturing, there's all the basic, useful, practical stuff. We're going to mostly focus on that. But I'll sometimes take it into some more esoteric, detailed stuff, and I call these AOs, academic orgasms, where you really see beautiful connections between different concepts. So we'll have a couple of those and then we'll come back down to normal stuff. So I joke, when I write a book, I said, what did I say in here? About academic orgasms. All right. Oh, I said, I had some joke in here somewhere. I said something like, there's going to be so many academic orgasms, you'll need a new change underwear. So anyways, enough of that silliness. What is the way medicine works? They always talk about standard of care. And standard of care sounds great, that's the standard. I want the standard. But the reality is you have to remember most medical patients, they're not doing so well. They're usually old people, cognitively slow, alcoholics, tobacco smokers, drug addicts, almost every single one of them is a functional illiterate. Stupid people get sick a lot more than smart people, okay? And the standards have to be geared to really debilitated people. Some of them are intoxicated, unconsciousness. The assumption is always made the patient is a complete incompetent and not capable whatsoever of doing anything to help themselves. Okay, and the standard of care is almost always going to be a drug or a surgery. Okay, so what I'm saying is the person who's more with it, able to watch a video like this, you should not want the standard of care unless it's equal to optimal care. You want optimal care, and optimal care usually means you have to do something for yourself. So the system has to function at the lowest common denominator. Okay. That's why a patient needs to study on their own, because the system, it doesn't care about you. It just wants to take your money. And if you want the best possible outcomes, you need to study a little bit and learn. Let's see. Like I said, most of the patients over 55 cognitively slow, 60 vast majority of them. And basically here you are, like this is a map and you walk into, a museum or something. You are here. If you go down the path of the typical chump, you're eating the meat and the oil and the processed foods, you're going to be on one pill after another, drug, then you're going to go for surgery because the pills don't work, chop, bye-bye money, premature death, okay? If you follow the low-fat vegan plan with no oils, that's the best you could do. Johnson's going to work longer than it would otherwise. You probably don't need to take any pills. I'm 60 years old. I don't take any pills. I don't have any medical problems. I've never had a surgery. That's what you want. And you'll probably die at an average of an age around 90. Let's see. Okay, here's William Roberts. He's another one of the great atherosclerosis pathologists. And he said, if you feed a herbivore a high-fat diet, they will all develop atherosclerosis, 100% of them. Well, that's what the Americans have. People who eat a Western diet. That's why also people ask me, should I go for a calcium CAT scan of my heart to check if I've got atherosclerosis? And to me, that's completely stupid. It's a waste of time. You already know you have atherosclerosis. You don't need to check. You know you have it. Now start preventing it. That's the intelligent thing to do. Other things too, I also joke that what doctors don't know is they don't know NETs, N-E-T-S, an acronym, N-E-T-S. N is for nutrition, E is for epidemiology, the E is also for endocrinology or estrogenic chemicals. The T is for toxicology, and the S is for everything that starts with the S. Understanding sleep, like the glymphatic system, understanding sedentary versus exercise, understanding spirituality in the sense that all the people who practice the major religions, they're much healthier than other people, okay? Maybe it's because they sort of give their problems over to God, if you will, and that lowers the stress level. Excess stress also impairs health. Okay, I'm going to go into why stress is so, excessive stress is bad for health later on. Okay, and then here's what I would say is what happens to a typical patient. It's very routine in a hospital. You look at patient charts, you see patients on 10, 15, 20, some of them are on 25 different types of medications. It's crazy, it's insanity. Okay, here's a maid milking a cow by Gerard Borsch. And that's basically what the patient turns into. They turn into like a cow, like a chump, and the medical system milks them every day, taking their money for prescription drugs, for diseases that they could much better treat with diet if they only were willing and able to do it. Okay, we're going to talk a little bit about diet comparisons. Humans are designed to be primarily herbivores. I realize in the wild people eat a little bit of other thing and some animal foods, and our omnivorous functional capacities enable us to sort of colonize the entire globe virtually, but we're best off when we're eating a plant-based diet. And especially, we've eaten the SAD diet when we were young, so we want to reverse some of those problems if possible. And so that's the way to go. Atherosclerosis plugs up arteries, blocks arteries, decreases oxygen delivery to tissue. A lack of oxygen is called hypoxia. If you have mild hypoxia, the cell might be decreased in its function, but it'll still work. When it gets more severe, the cell will die. Okay, and a sudden cell death, that's called necrosis. When it happens more gradually, like I was talking about in the example with dilatory, that's called apoptosis. The difference is necrosis is sudden death. The cell plasma membrane breaks open, its inner contents spill into the surrounding extracellular matrix, and you can see that on a CAT scan, like a big acute stroke. There is the stroke right there. I can tell you precisely where it is, what gyrus it's in. Versus apoptosis, it's just recycled slowly and it shrinks, and you just see a shrunken brain. There's nothing there except if you look at it under an electron microscope, there's fewer neurons. Okay, a cell is recycling itself. Okay, and then the other thing too is I talked to, and some people, they really don't understand what is being done. Okay, the first concept is there is conventional medicine, and conventional medicine sort of sees the world in a very sort of stupid way, black and white binary. Here is your pill. We don't really understand this disease. We don't understand hypertension. We don't understand atherosclerosis. We don't understand diabetes. Just take our pill. Hope for the best. We'll slow it down a little bit. Okay, then there's sort of a big high-fat vegan movement. In my opinion, I actually think there's a movement afoot to erase the legacy of Dr. McDougall, Kempner, people like VegSource, Jeff Nelson, who have taught and have shown the benefits of the low-fat diet, okay? And there's this big push for more and more fat stuff, nuts, seeds, omega-3, olive oil, canola oil, flax, etc. And I'm not a big fan of it. I think, the more fat you have, the more atherosclerosis you have. David Blankenhorn had shown that in his studies, etc. So I think the low-fat vegans provide a bunch of additional benefits, and often they're also low-sodium vegans, okay? But I just want to give you an idea where I'm coming from, because I'm not coming from the same place as a lot of these guys. Most of these guys are nutrition experts in nutrition, but they really haven't studied much about the brain. Their thinking is typically If it's good for the heart, it's good for the brain. If it's good for the heart, that's sort of like the epitome, the holy grail, the ultimate of health. But I would actually say there is another way to look at things. And I come from being interested in the brain. I was trying to figure out why are so many people becoming demented, because the incidence of dementia has gone way up. Okay, so I started studying a lot about toxicology, a lot about stimulants, conventional neurotoxins like alcohol, MJ is a much worse, marijuana is a much worse neurotoxin than people widely realize. All about these excitotoxin stimulants like these glutamate delivery systems of MSG, MFG, caffeine, and these other things that activate these NMDA receptors for glutamate in the brain. Aspartame, for example. Excessive psychological stress does the same thing. Lack of sleep does the same thing. There's other stimulants like, Ritalin for these attention deficit kids. I think that's insanity to give that. Tobacco is a stimulant for the brain while simultaneously, causing hypoxia. It's a terrible thing. Major neurotoxins in your drinking water, like I said, Al and F-. Circuit inhibitors are not widely known, but they disrupt calcium metabolism in the brain. Oh, also mitochondrial inhibitors. Mitochondrial inhibitors are a super important thing. They're not in any of the textbooks. They're not even in the biochemistry textbooks. I own 7 biochemistry textbooks. Nothing about mitochondrial inhibitors. And I knew they had to be a big deal because that's the mechanism of diabetes, insulin resistance, okay, with just fat, for example. So I started going through my journal articles and stuff. I quickly found over 60 mitochondrial inhibitors, and many of them are super common. Statins, metformin for diabetes, serotonin selective reuptake inhibitors, antidepressants, okay, and a whole bunch of other common stuff. Glyphosate, atrazine, okay, really bad. A lot of antibiotics are mitochondrial inhibitors. AL is also a mitochondrial inhibitor. A lot of estrogenic chemicals are mitochondrial inhibitors, including BPA. Okay, EMF. EMF is not widely known, but it's bad. You don't want to be holding your cell phone up to your head. Bad idea, okay? If you have a choice to hardwire your devices or Wi-Fi them, hardwire is always better. Always, if you use your cell phone, use your speakerphone. Don't have your router near your pillow at your bed where you sleep at night. Okay, a little bit about purpose psychology. We're not going to get into that too much. The fact that IQ can be raised, I've talked about that before. But basically, if you listen to all these, college professors, they're a big joke. And Jordan Peterson, he's completely wrong. Okay, don't get me wrong. He's smart. He knows a lot about IQ testing. But what he's wrong about is whether or not you can increase IQ. It's obvious you can increase your IQ. And you know why it's obvious? If you have neurotoxins decreasing your IQ, avoid the neurotoxins, your mental function will increase, okay? If you eat a low-fat vegan diet, you get more blood flow to your brain. If you get your sleep, your brain works better. Your lymphatic system cleans it. It goes on and on. If you learn study skills, time management, memorization techniques, your cognitive function improves. I mean, that's so obvious. To say that it's impossible is ridiculous. Alfred Binet, who invented the IQ test, said, of course you can increase your IQ. And I know that too, because I actually retook some of my standardized tests several times to see what would happen, and I kept getting higher and higher scores. Okay, and it's called an IQ test. Okay, my academic skills, as soon as I used new study skills and memory techniques, I kept doing better and better. Okay, those are considered IQ testing equivalents. Okay, I sometimes will talk about psychosocial stuff and the effect of religion and spirituality because they make a big difference in health and in the healthcare system. Sunshine's also a lot better for us than people realize. It does a lot more than vitamin D. It also unleashes nitric oxide precursors from your skin. That's why you feel good as soon as you walk out in the sun. It also facilitates maintaining your zeta potential of your endothelium. That Stephanie Seneff lady writes a lot about that. And also the nitric oxide peroxide nitrite pathway, the no pathway stuff of Martin Powell. So I go into all these things, the Douglas Kell, atheresa pretorius, postprandial endotoxemia mechanisms. Okay, so what I'm saying is I'm going to take you into a lot of areas that you don't hear about too often, and I think they're good to know. And the reason why all this stuff is good to know is because it's avoidable. You can do something about it. Notice what BS to Alzheimer's is. They just tell you, oh, it just happens. We don't really understand it, but take our pill. Maybe it'll help. Okay, that's nonsense. Whereas I'm going to tell you exactly what you can do. Don't eat this stuff. Okay, that's actionable information. Don't hold your phone to your ear. Use a speakerphone. It's not rocket science. Anybody could do that. Okay, just as far as these diets go, we all know the SAD diet, standard American diet's a disaster. It's high in fat, moderately high in sodium. Patients get all these terrible diseases, and they're basically fat, sick, and stupid by 55 typically, almost all of them by 60. And some people say, well, I've got a grandfather and he lived to be 90 and he drank beer and smoked and ate a steak every day. And my attitude is like, look, you could have 100 people, 100 blind people, okay? And you could have them cross a busy street. And a couple of them will get across, but it doesn't mean it's a good idea. Okay, if you look at the East Asians, like the Japanese, Koreans, or they're eating, tons of white rice, up to 90% of the calories. They were actually pretty healthy. They ate a lot of vegetables as well. But what got them in trouble is they had high sodium, like 12 to 14 grams a day. That would get them in trouble. And they smoked like chimneys, tobacco. Okay, so that was the main thing getting them in trouble. Otherwise, their diet was pretty similar to the Kempner diet. And they would be pretty healthy. Like the Okinawans were some of the longest lived people in the whole world. Okinawa is sort of like what Hawaii is to the United States. That's what Okinawa is to Japan. Okay, and then what about the people from India, the Indian diet? And basically, it's got a lot of good food, and it's primarily a vegetarian diet. But what gets people from India in trouble is they eat too much fried food. And then the fried food, then they end up with the same problem as Tetsumori Yamashima, the Japanese neuroscientist, was talking about. The omega-6 cooking oils undergo lipid peroxidation, produce toxic aldehydes like hydroxynonenal, and that just destroys things. Okay, it destroys the pancreas, beta pancreas cells, so they get diabetes. That's why you get all these skinny Indians with diabetes, because they got like a type 1 or type 1.5 diabetes with an autoimmune component, instead of being like a typical adult type 2 fat diabetic. Okay, it can also damage over time the omega-6 cooking oils, the arcuate nucleus in the brain, and that can disrupt their hunger center and make it harder and harder for them to ever turn things around. Okay, and then look at the low-fat, low-sodium vegan diet with no oil. You're low risk of everything. You're not going to get type 2 diabetes or hypertension if you started at a younger age. You're not going to get coronary artery disease. Risk of stroke really low. Risk of impotence really low. Risk of cancer really low. I mean, why wouldn't you do that? It's like winning the jackpot. You win on everything. There's no downside to it. That's what I do. That's why I do it. You know, that's really sort of like continuation of the McDougall diet, et cetera. I mean, that's the way to go. I sort of look at that historical pattern. I think, Kempner, McDougall, Pritikin, Veg Source, Jeff Nelson. I think they're all on the right track. They're telling you the truth. They're trying to help you. Because a lot of the docs on the internet, in my opinion, there's just too much money to be made by selling stuff. All you got to do is say olive oil is great. All of a sudden, somebody throws money at you, or other high-fat foods and stuff. So I think you got to be careful about that. Look at the biases. People doing it for hobby. I don't need to sell you anything. I do this as a hobby because I know it's a tremendously wonderful, important thing. Okay, let's see. We covered all that. All right. Like I said, it's like winning the lottery. It's good at everything, a low-fat, low-sodium vegan diet. And it's pretty simple. I was talking to an internal medicine doctor recently, and he said, some of the most useful stuff ever said about nutrition was what Pritikin said. Pritikin said fat is bad after reviewing all the literature on fat. Like the David Blankenhorn paper. Whatever fat the person ate, the more fat they ate, the more atherosclerosis they had. Like McDougall says, the fat you eat is the fat you wear. Whatever fat you eat, we can biopsy you and then we'll pull that fat out because it's absorbed so easily across the gut. It doesn't have to be remade into anything. Okay, why is starch so good? Because it's a polymer of glucose from a plant wrapped in fiber and it's low caloric density. So what happens is, first of all, it stretches the stomach with its low caloric density, so you get early satisfaction of hunger because your stomach is stretched. Then the intestinal enzymes have to peel the fiber off the glucose so the glucose can be absorbed into the blood, and that occurs gradually. So you get a slow, prolonged, relatively normal blood glucose curve. You're in the zone, you feel good a prolonged amount of time. If you just drink a soda pop with a bunch of sugar added, you spike your blood glucose rapidly. Pancreas overcompensates, drives your blood glucose down rapidly. That's called rebound hypoglycemia. And then you try to compensate for that lousy feeling of sudden low blood sugar by typically repeating the process, and you end up with a roller coaster blood glucose curve. So that's how simple sugars can lead to obesity. And they can also lead to bad behavior. People who don't understand why it's happening can get very skittish and impulsive and behave very poorly. They found, I gave this in a previous talk where I was talking about prisoners arrested. There was a lady, Barbara Stitt. She was a probation officer, and she had rebound hypoglycemia problems that caused her all sorts of problems. And when she fixed her diet, all that stuff went away. So she started doing that with all her probationer clients. And the recidivism rate where they got of them being arrested, like in 10 years, it was typically like around 75, 80%. But for her, it was only about 11%. So she had a dramatic improvement by fixing the diet for those persons. She also found most of them were all junk food junkies and alcoholics. Okay, so that's why starch is one of the great things. McDougall quote, all longstanding healthy populations eat a starch-based diet. There are no exceptions. He also said in another lecture, there are no fruitarian populations. Because I do think fruits are pretty good. And I do think that, starch satisfies your hunger with the fewest number of calories. It actually satisfies your hunger better than fruits do. But fruits are just not that widely available. They're quite expensive. They don't satisfy hunger quite as well as starch. A lot of their sugar is is from fructose rather than, a polymer glucose like a starch. Okay, so here's about caloric densities. Here's oil, the highest caloric density, about 9. Things like meat and cheese, sweets, simple sugars, more like around 4, close to a carbohydrates. There's going to be some other things in there. Nuts and seeds are super fat. Like nuts are like 80-90% fat. So they all have a caloric density like 6 calories per gram. Starch is only about 1 because the starch isn't just the glucose. It's also the fiber that's all wrapped around it. So it's pretty low in caloric density. Okay, and then vegetables are even lower at 0.1. So you get good stretch in your stomach, satisfaction, hunger. And that's why it's been said to eat your veggies first. Okay, McDougall says eat more and more veggies. He recommends push your veggie intake up to 50% of your calories because you'll be so full from all those veggies, you won't eat much else and you'll get skinny. Oil has the highest caloric density because it's liquid fat. Okay, the higher the caloric density, the more predisposed you are to gain weight. So if you want to lose weight, there's the big secret. Okay, the other thing to know is the lower the percentage of calories from fat, the skinnier you get. So you look at the Chinese population or other rice-eating populations where they were eating like 90% of their calories from rice, white rice, let's say up to about 1990, which has 1% of calories from fat. 1 billion out of 1 billion are skinny. It's like the only fat Chinese guy I ever saw in those old days would be like Bolo in the Bruce Lee movie because he was taking anabolic steroids. And the other things that are 1% of calories from fat are potatoes and sweet potatoes. Okay, fruits also tend to be really low in fat, most of them. They're also low in protein. I do think they're good food. I do think the reason we have color vision is so we can see fruits when they're ripe. And the younger and more active you are, the more fruits you can eat and handle them well and not get fat. Okay, this was just about those blood glucose curves. I showed you before the rebound hypoglycemia. You eat tons and tons of sugar in the drink. Your pancreas overcompensates. Blood glucose spikes rapidly. Pancreas overcompensates. You end up with rebound hypoglycemia and the roller coaster blood glucose curve. The perfect blood glucose curve is what happens when you eat starch. Just a slow rise, stays a little elevated, prolonged amount of time, you feel good. I call that the Goldilocks zone. Okay, when you eat fat first, the fat will cause insulin resistance. Then you follow that by ingesting a starch. Now, because your insulin's not working, you got an insulin resistance because the fat has caused overnutrition effect, if you will, on the inner mitochondrial membrane of the electron transport chain. You get insulin resistance, so now the blood sugar stays high a prolonged amount of time. That's why people who don't know any better will say, oh, you shouldn't feed starch to diabetics. They get prolonged blood sugars. Well, they don't get that unless they ate fat first, which causes the insulin resistance. And the fat kind of gets absorbed more rapidly, gets into the skeletal muscle more rapidly. So it's a good idea just to avoid high-fat foods. Unless you're desperate to gain weight, it's good to avoid the high-fat foods. Okay, this is glucose intolerance, glucose tolerance. So you eat the high-fat food first, and then you eat the starch. And the other carbohydrates, you're going to get a higher spike in your blood glucose than if you just ate the starch to begin with. That's what that's all about. Oh, Ivy League symbols. This is what I meant by it's a bit of a joke. Because the Ivy League schools, used to have the prestige, it's hard to get into them, supposedly the highest academic quality. But now they basically sold out to the drug companies and become kind of a joke. If you're a professor at one of these Ivy League institutions and you want to publish papers, you have to get grant money from somewhere. And the big corporations like the drug companies, they've got the grant money, so you have to please them. He who takes the king's shilling does the king's bidding. And so they're going to promote drugs, okay? And there's no money in this nutrition stuff, so they don't do it. They don't teach it. Typical Ivy League doctor doesn't know anything about nutrition. Typical ignoramus will recommend the Mediterranean diet. Mediterranean diet is what people say when they don't know anything, but they want to try to pretend they do. And it's really pretty much of a joke. Like you go out to Boston, they've got this traumatic brain injury specialty care areas. The main thing they're good at is doing autopsies, which really doesn't help the patient too much, okay? And you'll hear them recommending, even for these CTE patients, like those pro football players, chronic traumatic encephalopathy, they'll recommend the Mediterranean diet. It's completely stupid. As soon as somebody recommends Mediterranean diet, you should lose respect for them. They immediately have declared, it's like a neon sign on their forehead flashing, ignoramus, okay? Mediterranean diet allows chicken and fish and olive oil, fish oil, alcohol, non-organic foods. It's stupid. I call it the antichrist of diets because it pretends to offer salvation, but it just makes people fat, sick, and stupid. When Ansel Keys, talked about the original idea of the Mediterranean diet, it was largely a vegetarian diet, back in the old day. And he figured out that saturated fat from animal foods was a major cause of coronary artery disease. And then after that, there was a big push to recommend omega-6 cooking oils, but then they started studying those in more detail. There was a whole bunch of studies done along those lines. Peter Quoll in the 1950s studied sat fat especially, and then Meyer Friedman and Ray Rosenman studied these omega-6 cooking oils a lot in the 1960s, and they found they're just as bad as sat fat. They're really atherogenic, and they cause blood sludge, and they cause hypertension. Not good. There's a little bit of a trend right now, some famous psychiatrists promoting ketogenic diet for the brain. It is going to slow down the brain, but I don't want to slow down my brain. I mean, if you had a seizure disorder refractory to pills, maybe you would, but a lot of problems come with the ketogenic diet, okay, and the paleo, keto, carnivore stuff. You can make yourself lose weight in the short run with any diet because you're paying more attention to it. That's called the Hawthorne effect. But in the long run, you're running into all the problems. You're not going to be able to get around the fact that there's no fiber, so you're going to be constipated and everything that goes with that. You're predisposing yourself to kidney stones, okay? You're predisposing yourself to insulin resistance, to activation of mTOR, all kinds of problems. I think the paleo, keto, carnivore, low-carb diets are quite foolish, and the long-term studies all show decreased longevity in those patients. Dr. McDougall has a good talk on that. He showed the big 4 studies, and every single one, they had poor long-term outcomes. Okay, so what I'm saying is, if you have, this is kind of like the Dennis Burkitt joke. If you have, the Western diet, these high-fat, high-animal food diets, you're going to need a big hospital. And I joke that all the big hospitals are kind of like the Tom Wolfe joke. The modern buildings, they look like big animal cages, and there's always a statue of a turd out in front. I think these statues that look like a turd are insulting. They're degrading. They're disgusting. If you like modern art, it doesn't mean you're cool. It means you're stupid and conformist, okay? And they never cure any of these diseases, okay? And if you have people eating low-fat vegan diet, you just need a tiny little clinic because most people are healthy. Don't get me wrong. They're still going to have trauma. They'll need an emergency room, et cetera, et cetera. But all these chronic diseases, the gateway diseases, obesity, hypertension, diabetes, atherosclerosis, they go away, and most of the autoimmune disease. Okay, I had joked that Martin Luther put his 95 Theses on the wall at Wittenberg Cathedral. In my previous book, I called it The Medical Reformation, kind of joking about Martin Luther. Here's some Martin Luther quotes. He said, "Our Lord has written the promise of the resurrection in more than books. The promise of the resurrection is written in every leaf in springtime. A simple layman with stricture is superior to the Pope and his councils without scripture." So my version. An illiterate peasant with a starch vegan diet is healthier than an Ivy League doctor with the Mediterranean diet. So what I'm saying is, you could go to all the Ivy League hospitals in the world, and they cannot cure your hypertension or your diabetes or your obesity other than with gastric bariatric surgery. They can't cure you because all they're going to offer is a pill. And you could go to any one of these health coaches that just on their own have studied nutrition, and they were going to be able to cure 10 times as many patients as any Ivy League doctor, okay? Because the Ivy League doctors, they don't know the basics. Nutrition, epidemiology, toxicology. Okay, let's see, another Martin Luther quote. "If I am shown my error, then I will be the first to throw my books into the fire. I do not accept the authority of popes and councils, for they have contradicted each other. My conscience is captive to the word of God, and I cannot and will not recant anything, for to go against conscience is neither right nor safe. Here I stand, I could do no other, so help me God." Okay, and I kindly joke too, if I'm shown my error, I'll be the first to throw my books in the fire. "I do not accept the authority of Ivy League hospitals, for they have contradicted epidemiology, toxicology, the nutritional literature, and common sense. My conscience is also captive to the word of God, and I cannot and will not recount anything, for to go against conscience is neither right nor safe. Here I stand, I can do no other, so help me God. Amen." Oh yeah, and then by the way, I'm a Catholic, not a Protestant. I think the Catholic Church is a lot better at art, but the Protestant Church did a lot of good stuff. And they had the Victorian Renaissance with the Pre-Raphaelite Brotherhood, and there's students like Edmund Layton with some fantastic art. And a lot of great literature too. Oh, okay, there's some more quotes. I joke around about a lot of things in my books. I'm sort of having fun. Let's see. Will Durant, so I won't go into any more of that stuff. All right, let's talk about the Indian proverb of the 5 or 6 blind men and an elephant. Okay, so people have a tendency to jump to conclusions based on their own narrow field. And so the first blind man feels the elephant's tail, says, oh, it's a rope. Second guy feels its size, says it's a wall. Another guy feels its ear, says it's a rug. One feels its leg, says it's a tree stump. Anyways, the point is, when you study a subject, you want to study it from multiple points of view so you can obtain a more objective, comprehensive understanding of it. And the more you study nutrition, the more you will realize low-fat vegan diet is the only thing that makes sense. It makes sense from an epidemiology point of view. It makes sense when you look at the nutritional research. It makes sense when you look at the biochemistry, molecular biology of an individual cell. It makes sense when you compare it with your personal experience and your clinical experience and all the research done along those lines. Okay, a lot of people get emotional, like a lot of these paleo, keto, carnivore trolls when they comment. And I like Aristotle's quote: "The first step to an intelligent conversation is to remove emotions." Thank you. So basically, the pros, they're ignorant, and they get fat, sick, and stupid. And then when they're stupid, it's too late for them to turn anything around. And they just keep on going down the tubes and die. The people who are smart, they learn that, gosh, you can make tremendous benefits yourself with diet and lifestyle. And it's amazing how powerful it is. I've been a doctor over 30 years, and I can tell you, by far, there's nothing even close, by far, the most powerful thing in all of healing is this concept of a low-fat vegan diet with no oils. And the reason is it's a species-specific diet that, helps humans to run optimally. It's like if you own a car, if you own a sports car, you own a Porsche, and it says put premium gas in there, and you put premium gas in there. And if you don't put premium gas in there, you're going to have problems with the car no matter what you do. You can go to the best mechanic in the world, and what is he going to tell you? You should put premium gas in this car. A low-fat vegan diet is the premium gas for the human body, and you need it longer than a car. Your car lasts, 20 years maybe if you're lucky. Human body, you want to keep it for 90. Okay, religion makes people healthier. All the people that follow the big religions are all healthier. I think because it lowers your psychological stress is a big part of that. Okay, a lot of people are stressed out, sleep deprived, and drinking caffeine. That's going to suppress their immune systems and cause excitotoxicity in their brains to some degree. I like this painting here, Wanderer Above the Sea Fog by Caspar David Friedrich. And this is that idea of getting an objective viewpoint, looking down from above, seeing it once you understand the big picture on health and nutrition. Okay. Let's see. Okay, here's a nice quote by John Stuart Mill. About this idea of studying things from all points of view. It is only through a clash of adverse opinions that the remainder of the truth has any chance of being supplied. The only way in which a human being can make some approach to knowing the whole of a subject is by hearing what can be said about it by persons of every variety of opinion, and studying all modes in which it can be looked at by every character of mind. All ideas need to be heard because each idea contains one aspect of the truth. By examining that aspect, we add to our own idea of the truth. Even ideas that have no truth in them whatsoever can be useful because by disproving them, we add support to our own ideas. Yeah, let people talk and let people write their papers and then read them and figure them out. Because a lot of times what you're going to see in reality, though, is anything that doesn't generate money in conventional healthcare, it gets suppressed. It gets suppressed pretty heavily. You'd be amazed at how much it gets suppressed. Okay. And then what they'll do too is they'll always look for silly little pretexts to block a person who provides a unique point of view because they don't want them speaking. They don't want them getting in front of an audience, teaching people about this low-fat vegan diet because nobody makes money off of low-fat vegans. They're healthy, so they don't need the healthcare system that much. Okay, and you can expect they're probably got a good chance to live to be about 90. People following this, typical Mediterranean diets, they're going to live a little longer. In general, sad diets, they're going to poop out a lot sooner. And they're also going to hit what I would call the sick phase. This is the health span, so to speak, where they're no longer able to do too much. Once you're cognitively impaired, you're not going to do anything interesting. When I say people are cognitively impaired, what I mean is they still know how to find their way home. They can make it to the hospital, but they can't handle any nuance. They don't have any oomph. They don't have any energy in them, no vitality. Okay, I think I'm going to call it there for today. That was just sort of an introduction. And then in future lectures, we'll go into much more detail. So I hope that was helpful.
It's perfect. It's perfect. Thank you, Dr. Rogers. That was great. I want to give my little summary of it because I was not just paying attention, but I was following along in my copy here as we spoke. And essentially, the message is conventional medicine never cures chronic diseases, but diet can. Pills, stents, surgery, the cure rate is generally zero. Only 1% of people in the public know about nutrition, and the hard part being unlearning the myths that we're all taught as children. The most common deficiencies are a lack of fiber, potassium, magnesium, and nitrates that are all found in plants. We looked at the brain and you went through the concept of the penumbra, the twilight zone. After a stroke, it's the salvageable area that can come back to life. And the key is maintaining oxygenation to the brain and nutrients, which the plant-based diet can do, the low fat. And then you reviewed the theories of dementia, the mouse equivalent theory, the hypothesis of Jacques de la Torre, that you were going to talk about your theory, the Yashima theory about omega-6 cooking oils. You want to avoid those. Kellen Pretorius, the postprandial endotoxemia, promoting clotting and neuroinflammation, which is not good. Younger and Blaylock, the microglia activation. Is that it?
Microglia activation.
Microglia. Okay, yeah, activation, immune excitology. The Martin Pall what is it? The NO-ONO,
The no oh no theory. No oh no.
no theory, and relating to EMF, and but also showing that by some vegan cardiologists that have successfully reversed congestive heart failure. Then the last one was the toxin theory of dementia, Christopher Oxley, neurological damage from aluminum and other toxic heavy metals. And you discuss the ejaculatory theory where he tied off mouse arteries going to the brain and the shrunk and caused atrophy and dementia over time. Tying off arteries leads to slow death of brain cells because not enough glucose or oxygen. The overtreated hypertension, medication lowering your blood pressure when it's severely high, but it may also reduce the amount of oxygen getting to your brain. Your blood pressure is normalized, but the brain cells are dying, and leaving it high can cause problems. Lowering it too much can cause problems. You can be screwed in both directions. So Dr. Rogers' position is, instead of jumping to a pill, make your blood thinner. Make it thinner by getting rid of the fat in your diet that's clogging it up, and eating more fiber, and do things that lower the thickness of your blood, because arteriosclerosis is a blood clot. And De La Torre, he speculated on why Ronald Reagan got dementia, because after he was shot, he was hypotensive. He had very low blood pressure, and that probably led to worsening dementia over the next few years. You talked about Alzheimer's as a joke. The diagnosis can't be confirmed. There's no physical test. There's no blood test, MRI, nuclear medicine, autopsy. Nothing can actually confirm the diagnosis with any tests. And there's no treatments that work. Just there's some pills that have no real benefits, but lots of side effects. So what do you call a disease that you can't diagnose and that you can't treat? It's called a bullshit disease. You said that sounds logical. Glutamate, you said, awful, terrible thing for your brain, gradually progressive brain damage. If you're consuming that, it can contribute to dementia. A moderate dose can even lead to Parkinson's, and a single high dose could lead to ALS. So there's a lot you can do to help yourself, and you don't want the standard of care that the medical world or hospitals offer, because that's the lowest common denominator for the worst, sickest person. Low intelligence, eating awful, having no, good health habits. You want an optimal level of care. So that's why you want to learn and study for yourself. The typical chump gets pills, surgery, and loses their money. Those following a low-fat vegan diet, they don't need pills or surgery, and they live a long time without a lot of problems. And you talked about William Roberts. He fed a herbivore, a high-fat diet, and 100% of them developed arteriosclerosis. It doesn't matter what the source of the fat is. And you talked about the typical hospital patient being a chump. Patient turns into a cow, and the medical system milks them daily like a cow. And they could do much better with diet for their disease than what they're doing. Hypoxia, you discussed, lack of oxygen to a cell, too much. Lack of oxygen, it dies, but it's sort of a gradual versus a sudden death, a stroke versus slowly deteriorating brain. Conventional medicine only knows the drugs and surgeries. You talked about the high-fat phonies, that they don't really have the full picture, who you think want to erase McDougall and his approach. And I agree with you there. And low-fat vegans, they're good on food. Of course, they need exercise, and they need to be aware of problems and toxins, heavy metals, estrogenic chemicals, SERC inhibitors, EMF, or the benefits of organic and usefulness of philosophy, sunshine, religion, and so on. But beware of the high-fat phonies is your message. Low-fat diet is like winning the lottery, because it's good across the board. And Pritikin had the same message, that fat is bad. Whatever the source, the more fat you eat, the more heart disease increases in a population. Talked about starch satisfying by stretching your stomach, gradual release of glucose with breaking down of the fiber so it doesn't harm your blood levels, and dramatic improvement fixing the diet of prisoners. A study you talked about where the recidivism rate was much lower in those people eating the healthier diet. You talked about fruits being good, but they're not easily available. They're not as satisfying as starch. You talked a little about caloric density. Starch and veggies are usually very low in calorie density. eat your veggies first and more up to 50% of your plate, I think is what McDougall says. And if you're younger and more active, you can eat more fruits. And Peter talked about he doesn't accept the authority of the Ivy League in the way that Martin Luther rejected the experts and the popes. And the first step to intelligent conversation is to remove emotions. That was an Aristotle quote that got there. And just basically that smart people get great benefits from diet and lifestyle. And that it's amazing how powerful it is. There's nothing even close. And that the low-fat vegan diet with no oils is basically a species-specific diet. It's putting the right fuel into your machine, which is you, which are humans. And he talked about how religion, it can be known to lower psychological stress, and that standard American diet eaters get sick sooner and they die sooner. The Mediterranean diets do a little better, but the longest lived, the best is going to be the low-fat vegan diet, as long as you also avoid the other, bad habits and toxins. Health span is important. You want to live well all the way to the end. You don't want to be sick the last 10 years of your life. I think that's the basic summary. Thank you, Dr. Rogers, for another great presentation. I'm looking forward to your next one. I think we're going to do a live stream to where people can take questions, or where you can take questions. And so right now on the screen, you should see a link to another Dr. Rogers talks that we recommend. Pick another video and continue. Check it out. Give us a like. Thanks for watching.